We are live.
A bill on unused drug repositories of Vermont. And we have Jen Carby from Lunch Council who will go through quickly in terms of does this bill have an appropriation or a fiscal spending impact?
It has a future potential fiscal impact.
What is that?
Jen Carby, Legislative Council. So this bill would start the process of establishing an unused drug repository for Vermont. It would authorize the Agency of Human Services to contract out or enter into agreements with an existing qualified entity to create and administer the program to collect and distribute unused drugs in Vermont. And it specifies to the extent that funds are appropriated or otherwise made available for this purpose. It then goes into what the agency would do for their rulemaking. So they would start by adopting rules to administer the program, and it gives some parameters there. It has some provisions around limitations on liability for people who are otherwise involved with the system. So there wouldn't be liability for patients or for people who donated medications as long as they're acting in good faith. And then section 2 is sort of where we start to get into this committee's territory. This would direct the agency to provide an update on the status of rulemaking for the administration of the unused drug repository program as part of its FY24 budget adjustment presentation. The idea being that at this point, it is premature to be requesting money because they don't have anything to set up and they wouldn't know exactly how much it would cost, although they have some estimates. So they would start the rulemaking process and try to get that well underway and then come back and either as part of budget adjustment or the FY20.
It could be that it costs more to administer this benefit than we might.
Those are not the estimates from the health department. So Brendan from the health department is here if you want to get some of the preliminary numbers data.
It's your experience in other states.
Yes.
And is it in terms of, so we have, well, when it comes down to money, I haven't got a clue. Are we talking about 5 million? Are we talking about?
We're not, but can I hand you over? Are you okay?
Absolutely.
Can I hand you over to Brendan Atwood from the health department?
Thank you, Jeremy.
Yes. He is the subject matter expert.
Good afternoon. Brendan Atwood from the Health Department. Nice to be here. So the estimates that we received from 2 programs to administrators of programs in other states was in the ballpark of $300,000 annually.
That's when it's portfolio operation.
Yeah, and we think that's likely to be something we could accomplish in the first year or so. Part of the reason that we would be looking to contract with a third-party nonprofit who has the infrastructure in place to implement this program would be that we can get this up and running pretty quickly.
So let me ask, is the administration then supporting this bill and would support recommending an appropriation in the budget adjustment?
I don't want to get too far ahead of my skis in terms of what the administration might do for the next BAA.
Yeah, but you are the administration.
I'm not the last word.
No, I know.
But I think I can confidently say it's very likely.
Okay. All right. I mean, the reason is it's very helpful because sometimes we do have bills and the administration has already taken a position that this was not something that they would commit to looking at favorably. So
yeah, absolutely. This has robust support both inside the administration and outside. The thinking here was that we would need to, what this bill allows us to do is adopt rules. And we were thinking that we would do that first. In any event, we wouldn't be ready to spend this money imminently if it was appropriate this year. And so we're going to come back and
so this would be an ongoing cost, though, because the program, once it's set up, now the 300 is it? Would that be some upfront cost and ongoing cost would be less, or would there be upfront cost in addition to the 300,000 estimate?
That is the upfront cost. It's hard to project whether or not that would change over time. A lot of that cost has to do with outreach early on, and so I think it's reasonable to assume that that cost would come down over time. I do want to point out that the language in the bill doesn't restrict all other means for funding the program. It's the consensus of the stakeholders that we worked with that patients, providers, and those who are donating the drugs not have to pay to do so. But if the legislature were to ever appropriate funds or not appropriate sufficient funds, then we would have alternative opportunities to keep the program up and running.
All right, so, oh, yes.
So if the funding, if the idea is to have the funding in the BAA, it does say in creation of program, the may is conditioned on to the extent that funds are appropriated. So I'm not sure how strenuous to read that language, but it seems to say you can't create the program until we appropriate the funds or do the rulemaking.
What's that?
You want me to speak?
Yeah, please do.
So they may is that the agency may contract or enter into agreements to the extent that funds are appropriated or otherwise made available. So they can't enter into a contract without the funding behind it, but they are directed to adopt the rules.
I see, okay. So they could be creating the sort of regulatory infrastructure, and then when they get the money, they enter.
And it sounded like from the testimony that there might be other potential sources of helping to support this benefit.
Yeah, so there's a program in Georgia that we could contract with to support our unused drug.
Or to administer. I mean, that's
Right,
what
they would be administered.
Correct.
I thought you had indicated there might be other funding sources that you could explore to help support this, but maybe you need to clarify that.
Right, so if there was ever not appropriations for this, we would at least, we would have the option through rulemaking and other mechanisms to allow for some fees for people who participate in the program. We don't want to make the entirety of the program contingent on legislative funding. If, for example, it was up and running and providing a big benefit, there may be other opportunities, grants, for example, can be another place to look.
It doesn't look like there will be any real money appropriated till at least the last quarter of this fiscal year, and then going forward.
That's right.
And then it will have to stand and be evaluated within that fiscal context.
Yep.
Okay. All right, other questions as it relates to this bill? And it came out of Senate Health and Welfare on a what, 5-0?
500.
So other questions? Senator
Sure.
Much?
Entertain a motion.
We would. I think Senator Bruce would like to make a motion that we move the bill favorably.
I'm ready that as you
I
talk.
think I'm interpreting in between bites.
Yeah.
Is there a second to the, okay, Senator Birchlight?
For the record, it's an excellent sandwich.
Oh, thank you.
Looks healthy too.
I'm sure it is. Must be the lettuce and tomato. Well, here's your cookie.
Nice.
Mm.
Thank you.
Cost must have been high.
Well, depends how you figure cost.
Yeah, today is May 2nd. That's correct.
414.
2023.
I know, I write a check and it's like, am I writing the right year? Because we're doing 24, 22.
For fiscal year.
So,
Yes,
Lyons,
yes.
Birchliff,
Yes.
here, Star.
Yeah.
Weston, yes. Kitchell.
yes. Okay, Senator Lyons, or who wants to be the reporter?
I can report.
Oh, Health Department's you.
Well, or
Oh, do you want to?
doesn't-
report
no, it
I
doesn't
got-
matter.
I have you report it.
All right.
It doesn't
Rock,
matter.
paper, scissors.
I'll do it.
All right, so Senator Westman is the reporter. And now we're gonna move on to another, thank you very much for coming in. Page 206, and that's changes to DEVA.
I told her 1:45. I just let her know you guys are ready for her now.
Who is coming, the commissioner?
No, it's Mary.
Thank you.
Is someone can I step out and talk to Jen for a second?
Yes, you may.
And I'll be right back.
You can and you may.
May
Right? You're the English professor. No?
How often people would ask what you do, and I tell them, like, so I have to watch my language.
I'm always correcting Tim Ash if he's listening, and always saying me and, it's like, I can't believe Harvard didn't whip that out of you. They should refund your tuition.
He was playing soccer. when you should have been studying.
We didn't like some language in our budget bill, but I
Yeah,
wrote
we
it
did.
back. I said, I just wanted to make sure you paid attention. Apparently he was. Okay.
But apparently he's paying attention to us, but not his job. Are you watching?
Are we live now?
We are still live.
Yeah, so we still.
Countdown to
He said that to get his attention.
Oh, Countdown to Nirvana, is that what you just said?
Or is it countdown to 10?
Look at it.
The weed
You got a
factor.
He's
chainsaw?
not watching his face.
Sounds like a weed whacker.
We used to watch
You
every.
are getting it.
No,
Is that a chainsaw? When you're on the skate
He was
house
texting
lawn,
me about
it's
what was
usually
going on.
weed whacking.
Oh. Chainsaw.
I'm really doing some landscaping.
Some branches.
Yeah, but when you're from Danville, usually it's a chainsaw, not a weed whacker.
I know.
But when you're in Montville, it's a weed
I'm
whacker.
sorry, I'm from the countryside. Yes.
Well, that's.
Yeah, we're trying to
spoken like
embarrass
a farm
ourselves.
girl.
I know.
Or
Well,
the insulting Tim.
A couple times.
yeah, at least a couple times.
Peter likes the attention.
Yeah.
Regardless of what kind.
We could do art in state buildings. How long would that take?
I want to add an amendment to put the McDonald portrait.
Didn't they fall
It has to
together?
be prominently displayed.
A portrait of McDonald's?
That was
Have you
like
never seen
very
it?
expensive.
McDonald's?
It was over the
No, no,
governor's.
Mark McDonald.
I was wondering how long it was gonna.
Where is it? I heard.
Catch up.
It was over on the 5th floor.
It was expensive.
Why was it crazy?
It was Mark. This one seemed a little cloudy. I mean, there was some relationship
Maybe,
with the
maybe not.
painter.
Oh.
I'll find out later.
Where is it?
The artist and Mark. were
It was in the governor's
friends.
office.
Well, where is it now?
What are we talking?
That's been a couple of
David
years.
Sheets has
Senator
it
McDonald.
stored safely.
Where is it?
I bet you it's on off.
It's a really portrait
Really?
of him.
Of Senator McDonald?
Yes.
Why is it over
Not
there?
wrong. We don't know exactly where, it is, but you've seen, it.
I have seen.
So,
And
were you able to
do
sleep?
you want to give us page 206?
I
Yeah,
can't
this
burn
is-
it out of my.
This is another one of Senator Lyons.
Well, it's actually pretty.
All right, are you the reporter of this bill?
Yeah.
It was years ago.
This is the amendment that you guys voted out.
I don't know what the money is.
Yeah, well, you know, like.
We are gonna have a substitute proposal. on that.
Okay.
Just that Aaron's-
Yeah, that's the one
They
that's here.
You just sent over.
That's the one that's here. I printed it out. You guys have it.
I have a copy.
That's what the artist
Um,
said you would sell.
Andy? What's
Well, I thought that's how
I
we
thought it was
paid.
35.
Oh, was it that much?
But that's not what we paid for it, or that's what she said?
That's what she wants.
Was that last week? Did I put?
I was thinking of buying it next time I get through.
How much legislative pay for it?
Oh, you did.
I do it for you.
Sorry.
Is there a copy?
I agree, you should have.
I mean, we have one upstairs.
What was it? What were you doing?
Jimmy, who's?
100 what?
Is Ellen here for that?
Yeah.
Cameron,
Is here for this bill?
yes. And we just put together a substitute proposal amendment this morning,
Oh,
which is gonna take the place of the one that's.
In cash?
Yeah, that's the one.
Oh, okay.
Yes, that's the one.
Oh,
You just got.
We have,
this is our amendment.
11:48 this morning, and it's a strike all.
Like if I could. put
Yeah,
it
by
together.
striking out section 4.
No, it's not.
It's not a strike all, is it?
1, 2, 3 still exists.
Yeah, we're just striking section 4.
Section 4.
So,
One, two on the check-in.
This is,
all right, so, we don't have sections 1, 2, and 3. We just have this,
oh, where's the whole bill?
You need the as passed by house version. They have that one also. I have that here.
you have an electronic.
As passed by house. Pass that around.
I'm gonna have 2 copies of it now.
As passed by house.
Yeah, that's, and then we amended as passed by House.
All right, so Do you want to run through the bill then, and then what just transpired this morning in health and welfare? It looks to me like this is affecting the duties. Looks like it's affecting the benefits of our Medicaid program.
Yes, so for the record, Amber Napper, daily legislative counsel. There are two documents for H206 that I'm going to go over. The first is the as passed by House version, and then also there is a draft 4.1, which is the amendment coming out of Senate Health and Welfare. So starting first with H206 as passed by the House. Section 1 amends the statute concerning Medicaid coverage for adult dental services.
Now, we just increased the maximum to 1,500 in the budget.
Yes, and this is separate from what's happening in the budget.
Okay.
So you'll see, first, this is in section 1992 of Title 33. Subsection A, so for context, this is Vermont Medicaid shall provide coverage for medically necessary dental services provided by a dentist, dental therapist, or dental hygienist working within the scope of the provider's license as follows. You'll see down in subdivision 2, we're looking at diagnostic, restorative, and endodontic
Opposed to
procedures.
the other.
Right, and so it's adding language saying that the Department of Vermont Health Access may approve expenditures in excess of the maximum, and exceptional medical circumstances include emergency dental services as defined by the department by rule. And then it also added language in subdivision B at the bottom of page 1 saying that the following individuals shall not be subject to the annual maximum benefit amount.
Now, what is the price tag for that?
So,
I mean, you got
My
the
unders-
CRT, the DS, that's a fairly large population.
my understanding is that, so the two categories of people here on page 2, first you have those individuals through CRT and developmental disability service programs, and then you have Medicaid beneficiaries who are pregnant or in the postpartum eligibility period. So my understanding is that for pregnant individuals, Medicaid has been covering this population as it is written here. It just was not in statute for about 10 years. So this is updating the statute to reflect current practices.
What about?
And for the first, Romanet 1, my understanding is that the amounts that it would cost to cover these people is net neutral because there's a voucher program that's currently done through, I believe, DMH and Dale. And so the funds, instead of doing a voucher program, the money will just move over into DEVA, and DEVA will pay through Medicaid rather than have this extra voucher program through those
And the
other
administrative
departments.
work that goes with it.
Right, so my understanding is that this is a net neutral transfer that is in the budget, but so it does not have a fiscal impact to the
I can see
agency.
I think some of the psychotropic drugs might be a little bit hard on oral health, but maybe that's why they've been covered. All right, so you think that what it's doing is just having it go through the DEVA payment structure, but, and the payments that have been made for this population through Dale and DMH, would just take over. Is that in the budget?
So I believe the existing voucher, it's embedded in the mental health budget. We'll see through budget adjustment as well, the dollar amount that moves
You'll have to
over.
move over.
Yeah.
All right, keep going.
Section 2 is concerning the use of prior authorizations when Medicaid is being reimbursed from a third-party insurer. As you know, Medicaid is the payer of last resort. So this section 2 amends sections 1908 and 1909 of Title 33. So on page 3, you'll see that the language says that if an insurer requires prior authorization for an item or service, the insurer must accept the
It's
agency.
sort of like deemed as meeting the prior auth
Yes.
requirement.
Yes, so if the agency if the agency provides an authorization saying, yes, this item or service is covered under the Medicaid state plan or waiver, then that authorization counts as the insurer's prior authorization.
I'm sure the insurers must have testified on that. All right,
And then section 3,
I still think this is strange calling it the duties. To me, duties are administrative activities, and these seems to be more in terms of benefit.
They are benefits.
You know, enhancements or something. All right, page 4.
Page 4, section 3, this would have been section 4284 of title 18. This is concerning protection and disclosure of information that's in the Vermont prescription monitoring system. So this is one small change in subdivision C on page 5 that would authorize a designee of the medical director of DEPA to access VPMS for purposes of Medicaid quality assurance.
That one.
Yes.
Now we're down to section 4, which
Section
we should
4,
look at.
so we switch over now to draft number 4.1.
Oh, my goodness, you popped this right up. Okay.
Section 4 is a report section. This is concerning federally qualified health centers and alternative payment methodology. It requires DEVA to collaborate with representatives of the FQHCs to develop a mutually agreeable alternative payment methodology for Medicaid payments. The FQHCs that is at least equal to the amount that would be paid under the prospective payment system established under the Benefits Improvement and Protection Act of 2000. So there will be a report in October 2023
So
about
is that a change from the House?
it is,
We changed.
we did, the committee did make changes, not large changes, or at least word-wise, not large changes. So the original language still had DEVA collaborating with the representatives of the FQHCs to develop a mutually agreeable alternative payment methodology, but it did not have the language of that is at least equal to the amount that would be paid under the prospective payment system established under the Benefit Improvement and Protection Act.
Does that suggest we're paying FQHCs less than the prospective payments to the Benefit Improvement and Protection Act?
Because that's quite a hefty bill. Tell you.
Are you talking about price tag? Price tag?
No, the bill itself is that was written in 2000 is a fairly comprehensive bill. So this is not putting anything in place, it's simply asking for information.
But it would suggest that our current methodology is not paying as much as the prospective payment system would. So what you're trying to get to here is the disparity in payment between a privately practicing primary care versus an FQHC. I'm just trying to understand
Yes,
what the intent
between Medicaid payment to private insurers and FQHC, which are Medicare. So,
Okay, because FQHCs already have a methodology that
right.
we're required, well, I guess we've had a request that we're not
We're
paying
not
as
meeting the
much.
requirement.
We're not meeting the requirement, and so they've got a $6.9 million request. We didn't fund all of it. But I guess what I'm trying to ask is, do we have as a policy option the ability to have an alternative payment methodology under the federal rules? I guess that's what I'm trying to understand here, because I thought FQHCs had a separate payment system.
This is for Medicaid payments.
I know,
to
that's what I'm,
FQHCs.
no, I know, that's what I'm talking about.
So Medicaid can pay differently from what others are, that Medicare would be paying or others are paying. I guess that's what looking at him.
I am not sure the
That's
answer
the
to that
question.
question.
As
Yeah.
I understand the 6.9, we aren't, from the FQHC's point of view, we aren't meeting the statutory requirement right now. So this is a portion of that 6.9.
Well, I'm not sure what the 6.9 goes up to, and whether we're trying to be, in a lot of cases, we're trying to get to parity with Medicare. And that caused problems when Medicare actually did a reduction in certain parts. So I guess what I'm trying to understand is what we have the policy options for alternative payment methodology. I thought we had a prescribed methodology, we just weren't funding it at the level that the FQHCs would like. So Senator Lyons.
So if you look at the Benefits Improvement Protection Act of 2000, as I did really very briefly, one of the things it allows for is a determination of differences along in geographic areas, including rural hospitals. So this would allow for rural hospital payments that have reduced cost sharing per patient, increased
But this is
reimbursement.
FQHCs.
That's what I'm
Oh,
looking at.
I thought you were
Benefits.
talking about hospitals, I'm sorry.
I'm looking at the Benefits Improvements and Protection Act.
Right, but I thought the language you said was related to hospitals.
No,
Oh, I'm sorry, that I misunderstood.
yeah, I did, but that's part of the bill.
Oh.
It's a bit large bill, so it'll be a lot of work on the part of whomever is doing this to bring information back to us.
All right, so this is just, they can develop it, but then ultimately what it costs to fund it is something else. There's
Yes.
nothing here.
There's nothing here that says we have to do anything
Okay.
once we have the information.
What is it that we're trying to address?
I think we're trying to look at equity of reimbursement across the board, in particular for primary care, and FQHCs are sort of fundamental in that area.
Well, I agree. I mean, the majority of primary care is provided through the FQHCs, but I was just wondering if it would suggest that the current methodology is creating disparity between those primary care provider populations. I don't know.
It could be, and the FQHCs are very interested in having this happen. And actually, this was part of DIVA's underlying bill, the original section 4. We've just added in the section on the Benefits Improvement and Protection Act of 2000. That's part of it. Yeah.
Shall we move on?
Yes.
Oh, this is getting, and is this new, number 5? This gets into,
So we added this in committee. And Aaron can go through it, but it was a request on the part of Blueprint and the administration to have, look at this information. It was, the House is also interested in looking at it. You may see it coming up in the budget conference discussion.
I know that you've made some reference to the fact that the level of financial support for the Blueprint, the community health teams varies according to payer. And I guess that's what you want to make sure down at the
Trying to
bottom.
determine
Your
that.
goal is all peers contributing on an equitable basis for that support.
Yes, and in addition to knowing both the payment and the patients, number of patients who are cared for by the community health teams, based on who the payer is, whether it's private payer or.
So the administration supports this?
As far as I know, yeah. Yes, they do. Gave us this, yes.
Well, they gave it to you. Okay. All right. The Blueprint is certainly expanding as we're doing the pilot. I guess at some point raises the question, and that's the intersection of all that we're investing in Blueprint around health promotion and prevention and what we're paying the ACO to do, which is
Quality-based
same
analysis.
thing, I know, so may lead to,
We have a lot of work cut out for our committee next January.
well, I think we added up in the Blueprint right now, all pairs was about $40 million. So it's a very significant program that has grown from the days of Craig Jones when that position was funded right here in this committee. It's just kind of interesting as we're looking at the investment that we're making in the Blueprint and how that fits relative to some of these other efforts that we're looking at, health promotion, data analysis, that was set up to be very data-driven and data-rich. And so I'm bringing it up because we talk about the blueprint, and it used to be about a $5 million program, but it's now 40 million. And you look at it relative to other areas of spending, and we tend to not know the extent to which the investments and the community health teams, which are really a critical piece of this initiative, and it's unique to the blueprint. So, all right, well, we can look forward to taking a look, because it seems like so many times something starts and it evolves and we add and it grows, and initiative to better manage healthcare.
And then looking at how it's funded, and this adds an analysis or consideration of looking at the healthcare claims tax, which hasn't been looked at, I don't think.
Well, we do use that, don't we, to fund the, yeah, okay. And section 6.
Section 6 is a repeal of a repeal, so a repeal of a sunset. 18 VSA 9473 subsection G is scheduled to be repealed effective April 1st, 2024. And this is a section that says a pharmacy benefit manager shall not require a claim for a drug to include a modifier or supplemental transmission to indicate the drug is a 340B drug, unless the claim is for payment by Medicaid. Nor can the pharmacy benefit manager restrict access to a pharmacy network or adjust reimbursement rates based on the pharmacy's participation in a 340B contract pharmacy arrangement.
So this just keeps that.
It keeps that prohibition in the law. Section 7 is concerning hospital liens. This would amend section 2251 of Title 18. Currently, if a person is injured in an accident and they stay in a hospital and they have expenses from their medical, they have medical costs from the services they receive by the hospital, separate from pursuing insurance, could pursue a lien against any monetary reward that patient receives if they should file a lawsuit later on to recover money for the accident. So this section amends the hospital lien section to say that if the patient has Medicare, Medicaid, or health insurance plan, that the hospital cannot pursue a lien under those circumstances, except that they could pursue a lien for the patient's cost share portion. If the insurance pays the co-insurance of 80% and the patient still has that 20% responsibility, the hospital could still pursue a lien on the 20%.
I mean, they were doing liens for 100%?
There was nothing prohibiting them from doing it.
But they probably in practice were not, were they? Or maybe they were. Was there evidence that they were?
I think there was testimony in the Senate Judiciary that there were some cases where people were put at disadvantage because of because hospitals sought a lien against the future liability settlements. So there was one Fletcher Allen, I'm trying to remember what they were, maybe if you're on Dick and Phil, or Senator Sears, Senator Bruce are both on judiciary. We did take testimony on that. I do have that.
On this lien section?
Yeah.
And
Hospital liens was strongly supported by our committee.
It's in rules now.
No.
Yeah, the bill is in rules, but they're adding.
But aren't hospitals allowed to deduct their losses from their taxes, or are they exempt from?
Well, they're
taxes?
nonprofits.
Oh, so they don't pay any.
they have a common good requirement.
Yeah, so the problem is that the patient is in the hospital, and before the hospital would identify any insurance coverage that the patient might have, the hospital could begin a court procedure that would allow for the hospital to collect all of the liability that the patient might be left.
I see.
The result is, if suppose you have an underinsured or uninsured patient, and there is a liability, and the hospital goes after that, that money can be collected by the hospital, but it doesn't serve as the payment for the cost of the hospital. So it gets confusing, not really confusing, it's just the patient is left uncovered. Now, on the other side of it, you could have a case where the hospital isn't recouping its, the cost for coverage, so.
Well,
But it harms people who've been in accidents or something like that, and they can't get.
Yeah.
Their damages are not repaid. The hospital takes the money, that's the hospital.
That's the big deal.
the hospital takes the payment reimbursement from the insurer and
Yes.
and both? Oh, wow.
Yes.
Under current law.
Oh,
But it
allowed to
doesn't,
do it.
what they're allowed, but, what,
I don't know if they do it all the time. but
so I guess then,
that's why they want it.
judiciary has dealt with it and you
Yeah.
support this, okay, all
But the
right.
bill is in liens, it's in rules.
It's in lead.
Well,
But there's
Jean
not
was
this
saying
bill,
she's got the text here.
Yeah, I've got the text here, there's another bill?
H75.
An S, there's an S bill.
79.
It sounded familiar,
Yeah,
It's
S
okay.
79.
That's
We
just hospital.
voted it out, but it ended up.
so
in-
let me ask, is this basically doing what that bill did?
Yep.
Okay,
And
It
we
is that
voted it
bill.
out.
oh, it is that bill,
It is
okay.
that.
We
All right.
voted it out, but it was too late for crossover.
Oh, well, any other boat leaving the harbor, so let's keep going then, and we're now on to section 8.
I want to announce that I have to leave for a few minutes. Alice Miller, your representative, Miller,
She's getting
is receiving an award at 2:00. So
She and who's the second person getting the award?
Alice didn't tell me.
I thought there was a second person from Vermont, we got the notice
I
from
don't
the
Where is she?
New England.
see a creek.
Okay, so let's go then to section 8 and then get through this before maybe Senator Sears has to leave. This sounds familiar too.
So it looks familiar. This is actually the result of Act 167. Within Act 167, we're supposed to get reports back on the community needs assessment as well as for the hospital financial sustainability reporting. And then any, work on budgeting for hospitals. What's happened in the interim between when the bill was passed last year and the work that's going on between the Agency of Human Services and your Nat Care Board is that they have really worked closely with some of our hospitals and identified hospitals willing to go ahead to look at transformation planning. So how hospitals are gonna meet the financial needs of the future while maintaining care and quality.
So
the-
this is not in the
This is-
original building, this is
No,
also.
this is something that I have added as a result of having conversations with the board and the agency.
All right. Well, we'll see, it looks very familiar, so we'll
It is.
keep trying. And then everything, just the effective dates.
Yeah.
So committee, any questions, or I guess there's no obvious direct appropriation here. Could be some movement of dental costs from one pocket to another. If there's no questions, I'll take a motion to move the bill favorably. Senator Starr, and seconded by Senator Sears. What's your? We'll call the roll.
Senator Burke, Senator Lyons.
Yes.
Senator Burchett,
Yes.
Senator Sears,
Yes.
Senator Starr.
Yeah.
Yes.
Yes. So we, 7-0, and
I'm quoting the bill. though.
Yeah, sure. I do leave, but I'm more than happy to have you do this. I think it's going to make good sense. So now we're up to 2:00 and,
Becky Wasserman is tied up until 2:30, so if you guys want to take a break or something.
well, I think, Senator Sears needs to go upstairs momentarily.
Yeah. I don't need to be there long.
And the big question would be, could we switch something?
Becky Wasserman is the capital bill and 102.
Oh, she's both?
Yep, and she's tied up until 2:30, so.
Well, how complicated is 102? Huh?
Did institutions have any amendments at all to it?
What
Or
if
just as it passed the House?
Art and state on
They did pass it out as a committee.
It's just as passed by the House, so.
Okay, they didn't amend it.
So maybe we could just take a look at it and it may not require,
It codifies art and state buildings.
Yeah, they, institutions
It
didn't
does.
do anything with it.
Appropriate money to buy one art. It increases the art budget.
oh my goodness.
Creates a fund.
They have their amendment.
Be prepared for an amendment about.
They already have their-
Sculpture.
I was thinking about
at
that.
the same time.
At the same time, okay.
You have that one playing more.
There's always room for a McDonald's.
Could you have one more? Henry?
The Marble Palace.
That would be good.
Oh,
So it creates some, it doesn't look like it appropriates any money or transfers any money.
I can't see.
That's what they told me.
So,
Good idea.
So this would be a fund that would only receive transfers from the General Assembly, it'd be separate from the funds of the State House.
Harrison told me that they increased the fund from 50,000 to 75,000.
But this is not only, this is in state buildings and facilities.
Yeah.
So this could be art in our
Like
correctional facilities to,
section, the very bottom of section 2,
that would be a good place for them.
on page 8, page 8, line 14.
What happened during this?
so project needs new construction, which
Nobody
may include
expects
in
this back.
addition with total cost of $1 million or more.
So it's setting a floor of how much, if there's an absolute of capital money, would have to go into the fund.
That's what that said.
Yeah, it's a little unusual because it's capital bonding money. I think we usually push that into special funds.
I was in the state house.
So I thought too.
The state
What
charity.
section is that in?
It's on page.
Oh,
eight.
yes, I can see
Yeah.
page 8.
It's a slightly,
Yeah, not less than
Unusual structure.
75,000.
What did they make David Sheets through?
This- This puts Vermont Council on the Arts administering the program? That's interesting.
Sure.
I mean, does this include the State House or is it,
Oh, it includes all state buildings and facilities.
I mean, seems like something David Sheets might.
They're establishing the advisory committee. Was that in session law? Is that,
I don't know. I know we've done art
I know we
in
have.
the past.
I thought it was, there's something specifically that's like art in the State House is different than art in the other.
I imagine it is because,
So it's, the administration is, Council of Arts is lead, coordination of VGS and Art and State Buildings Advisory Committee.
so what this is doing is saying we intend to provide ongoing funding for the commission of works of art. Purpose and intent. So the question becomes, one, I guess we have lots of lofty intents. Sometimes we don't fulfill them totally.
What's this?
Do you know if the administration took, we don't know that, do we?
I can look at the capital bill and see if the 75,000 is in there.
All right.
Okay. So the advisory committee oversees the administration of the program, but they're made up of commissioner and
Well, then we've got a whole lot of legislators.
Chairs of House and Senate Corrections Institutions.
Wow, yeah. Spend it one bit.
Not less than 75.
I don't know.
Let me get somebody external.
Why do we need legislators on arts?
On the advisory committee, I don't know where.
Isn't there already a group that does this?
Friends of the State House.
But that's just for the state house.
This was just-
This is for state buildings and facilities.
There was a committee.
No, I thought it was art and state house that we dealt with before. This
We
is
did.
expanding it to state-owned buildings.
Right, but wasn't there earlier bill about creating an advisory committee to help?
That was just State House.
Both the House and the
That was
Senate
Ruth's
capital bill
Yeah, to
has
redo that.
$75,000 in it.
Basically, to
Well,
fix
that's-
the lack of
Now.
But both the House and the Senate capital bill has the $75,000 allocation.
This is creating a new advisory.
This is to oversee the Arts Council
so-
administration of the program, similar to an advisory committee for the state.
I want you to know Stephanie has researched, and the House budget included the 75,000, the House capital bill.
And so does the Senate.
And so does the Senate capital bill. It carries the same appropriation,
Oh,
75,000.
so why do we need to do anything on the money?
You don't, you just got the bill because it's doing something with money.
So basically, it's,
And I was told it was 50.
So it's-
50,000, so we're raising it 25,000.
did we?
That's what I was
I
told.
can explain.
Yes, why did you come down rather than our
Okay, we have
attempting
what
to,
council
I
define.
want to know, is this something new or is it moving it from session to green books? And have we been doing it with, we have for the State House, but also this is for state buildings and facilities. So if you want to join us.
Yes.
Helpful. Otherwise, you're going to listen to us fumble around and you'll probably cringe at how little or how much we're confusing things.
Hopefully clarify. So Becky Wasserman, Legislative Council. So H102 is the Art and State Buildings Program. There is currently in statute the Art and State Buildings Program. And so section 1 of this bill is repealing that current program from statute. I would say in large part because it is was sort of cobbled together over the years. And so the process that is currently laid out in statute does not accurately reflect what actually happens. So I will explain what happens, and this is hopefully what the language is doing, is that there is a process by which certain buildings that are receiving capital funding are identified by the Department of Buildings and General Services to be sort of eligible to have art projects installed as if there's a construction renovation or maintenance project happening.
Over $1 million.
Right, and so they take a look at what those buildings are eligible in the capital bill each year, and then work with the Arts Council to come up with some recommendations for this Art Advisory Council. And then the Advisory Council approves projects to receive funding. And the way it's currently worked is that there hasn't been a separate line item in the capital bill for that funding. The funding, which is currently set at $50,000, is coming from the project budget of that project. So if, just using an example, if like the State House were approved to be an eligible project, they would take $50,000 from whatever, amount was appropriated or whatever work was being done at the State House to install the art project. So what this change in appropriation is doing is taking it out of the project budget so that it's not really hidden in the project budget anymore and it's more transparent. And also sort of requires BGS to not requires, but it allows BGS to not use the amounts that are appropriated to them for another purpose for this art project. So it's like setting up a separate line item for these art
In the
projects.
capital bill.
Right, and so it is increasing it from 50,000 to 75,000, and it's asking BGS to now include that 75,000 as part of the governor's recommend that comes to the legislature every year, rather than through this more like hidden process.
So the advisory committee, that already exists, and already changed the composition at all?
Advisory committee.
Because it says you have the chairs. Senator Eagles wants to be on, the advisory committee, I guess.
Just want to double
And
check.
no art on the runway.
Excuse me?
No art on the runway.
So I was just wondering if in the, length of the program that's being repealed, and this is replacing it.
Whale's tail.
So currently, that advisory committee has the commissioner of BGS, the director of the Arts Council, the chairs of the House and Senate Institutions Committees, and the chair of the Vermont Board of Architects. So the state curator is in addition to the council. The committee.
So in essence, this is taking what has been there. Amazing what's in statutes if you start looking at them. And it's just basically saying the 50 is moving to 75, and that would be included in the capital bill, the budget request.
As a separate line item.
As a separate line.
And how long is it been at 50? A long time?
And a long time. I would have to get back to him in a number of years, but I don't think.
That would hardly
it's been-
purchase Senator McDonald, 35, huh?
There's some debate about how much.
All right.
I think it's been over 20 years that it's been that amount, but I can get back to you on the amount of time.
thought I had to go through this committee first.
Which,
Yeah.
So, subcommittee, I guess what we have is, actually is an update and trying to get, maybe in a more cogent way, the statute around art in the State House, setting forth to raise the amount that hasn't been raised. And it's really, not something new, it's just sort of bringing up to date what's been in place for a while. And there's no specific appropriation for what would travel through the capital bill.
Right, and it is actually for art in all state buildings, so
I
this
see that. That's why we were talking about all the different potential areas.
Well, it doesn't even have to be a building, I don't think. It could be a camp or, a campsite
Or an permanent structure.
Could be a sculpture. Oh, could it be in, oh, well, no, what does it say? State buildings and facilities. So I suppose a state park could be a facility.
state park.
Okay, so the possibilities are quite expansive. Do
Creative.
I have a motion to move this? Senator Starr is the second.
I think they should deal with Tom Chipman, should update his statute, because that doesn't look anything like.
It starts in.
Doesn't look anything like Senator.
He's from my town, so we have one on.
So we're gonna call the roll.
Baruch.
Yes.
Lyons.
Yes.
Burchett.
Yes.
Sears.
What are we voting?
Say yes.
Art in the state. Art.
Oh, of course, yes.
Star.
I like art.
Weston Chester.
He's a nice guy.
Yes. Yes. Okay, so, who has the BGS? Don't put your hand up all at once.
I'm guessing first.
Probably.
Sounds good to me.
That great report he gave on the float this morning.
Yeah, it's
Yeah.
in there virtually.
Caused the electricity to go out.
Yeah.
Oh, all right, Senator Purchase, the reporter. Now we're gonna move on to and actually, we have the capital bill, and we're moving so far ahead.
Becky?
Do you wanna go back down to House Appropriations and come back to us?
Yes, I'm gonna see where they are.
Okay,
from
I
that.
think they're ready for you.
Okay.
Come back.
On the capital bill?
Okay,
So,
Our momentum is gonna be.
I know.
Actually, you guys are so speedy today.
You knew that we got
Yeah.
it simple.
We gotta keep going while we're going through.
So we're not supposed to come back until 3, but.
I'm sure she's probably not gonna take that long in House Appropriations. Let me chat with Dan and see if I can get him here a little
All
bit.
right, so why don't we just go off live, take a break, see what we might have some small bills that we got out of the half dozen that we got today. And then take up the capital bill as soon as we get Becky back, and then we'll go back on live. So we'll take a break.